Hello everyone. Am I audible? Okay. Hello everyone and welcome to my one day class on REBT. Today we will Yes, yes. I'm really happy to see you all here for my one day class. And whether you are a therapist or a student of psychology, a coach, or just someone curious about how our mind work, so you are on the right place. Today we will learn about the therapy model, which is practical, powerful, and very close to my heart, which is REBT. Full form is Rational Emotive Behavior Therapy. Okay. So I am Ria Khurania. I have completed my master's in counseling and family therapy, and I have an experience of more than 2 years in this field. Okay, so I am the founder and the therapist, main therapist at the Psychicc Mantraa. We are basically a Delhi-based organization. Along with being a therapist, I am also a career coach, NLP master practitioner, mental health coach, and expert in psychological first aid, women empowerment coach, and a parent coach. Along with that, I have two awards in this field. First is the Best Women Mental Health Coach of India, and second is Global Excellence Award in Mental Health Supporter. So this is all about me. Before we start further, just give me a quick intro. That what's your name? What do you do? And what are your main expectation from today's masterclass? Just a quick intro about yourself. If you want, you can open the mic. Otherwise, you can just write it in the text. Alka ma'am from Kerala, Masters in Psychology. Okay. Yes, Nanika Gupta ma'am.
Okay, so hi, my name is Nanika, and I'm currently pursuing my bachelor's second year from Rational Emotive. And
Okay.
glad to be here because I have never heard about REBT, so yeah, I'm happy to learn about it.
I hope you will learn a lot and this will help you in your future references. And Alka ma'am, welcome back. I know in last workshop too, I saw you a lot. And I hope like last time from this workshop also, you will learn something that will help you out. Okay. So Riddhi ma'am, she's a psychology student and looking to learn the application of the REBT. So yes, so today this is what we will exactly doing. So today we will understand that what is REBT and the irrational belief. We will also learn about the ABCDE framework and then master the 7 powerful REBT tools that can help a psychologist or even a therapist in their therapy session. And we will practice with a real life case that will help you to understand about this. Uh, okay, so yes, Mandarji. Sorry if I pronounce your name wrong. I'm very bad with the names, so I'm sorry if I pronounce it wrong. So, but I welcome you all. I know there are many people who want to introduce themselves. They can just leave it in the chat box, and we will have a discussion in the upcoming thing because we have a lot of things to be learned. Okay. So before we start with what is REBT, so have you ever heard about REBT or what does REBT meant to you? What did you understand with the word REBT or with this psychotherapy? Yes, ma'am. Yes, Nanika, ma'am.
Yeah, so I heard about it in class 12th, I guess. It was just a short line answer where we understood that the therapist they help us in changing our irrational beliefs to rational beliefs.
Good. Okay, identifying the irrational thought pattern and reframing into the rational ones. Correct. So, this is what exactly the REBT is. So, REBT stands for the Rational Emotive Behavior Therapy, which was created by a psychologist, that is Albert Ellis. Okay. So, here's the core idea behind it. Okay. It's not the event that upset you, it's your belief about that particular event. For example, imagine two students who both get low score on their test. Okay, so one of them may think that, okay, I didn't do well this time, but I can learn or I can practice in this field, and from this I can do better next time. Okay, that student feels a little disappointed but still have a motivation to go forward in the life and to do better. Okay, but on the other side, think of a student in the same situation. He may think like, this is the proof that I am a total failure. Okay, I will never get succeeded, or this is the worst thing that happens in my life, and because of this nothing good can happen to me. Okay, it's like I am a bad fortune, I have bad fortune. Okay, I'm not lucky for anyone. These kind of thoughts this student can have, just because the situation is same, that both the student have the low marks. Okay, but this student uh, doesn't feel any motivation or doesn't feel anything, and that student feel ashamed, anxious, or maybe even he is depressed. Okay, now what we have to notice is both experience the same event, but their emotion, the behavior, and the action they may take in the future are completely different. And why this happened? Because of what they believe about the particular situation. Okay, so REBT focused on helping the people identify those irrational beliefs, like I must always be perfect, or everyone must like me, and then dispute or replace that thought with more rational or more the practical one. Okay, so the end goal is emotional strength, self acceptance, and healthier way of thinking and feeling. Okay, is this thing clear? Am I going too fast? Okay. So, moving forward with who created the REBT and why. So, REBT was created in 1950s by Dr. Albert Ellis, and honestly, he was kind of a rebel in the therapy world. Okay, back then, psychoanalysis was the main approach that was frequently used, and people would lie on the couches, talk about their childhood, their traumas, and go to the therapy for the years. Okay, and by this, Ailes feel very frustrated. He always thought that why is this taking so long? People need something practical and active, something that actually help them to change their life now. So he created the REBT, a method that is structured, that is goal oriented, and focus on the present belief that are creating the emotional pain. Okay, he believed that irrational thinking, not just the past experiences, was the real cause of the emotional distress. So instead of just understanding, yes, yes,
Sorry to interrupt, but isn't CBT also do the same thing? So how can we differentiate between REBT and CBT?
okay. So this is one of the topic that I have included in this presentation. Is that okay if I take that question over there?
Yeah, sure. Thank you.
Okay. So, so where was I? Mm, okay. Um, so yes, instead of just understanding why we suffer, so REBT focus on what we believe and how we challenge and change the belief system to feel better. Okay, that's what make REBT different. It's not about the endlessly analyzing, it's about taking emotional responsibility and learning how to think in a way that serves us. Okay, now, why REBT is worth learning? So let's break down it into the three reasons. First reason is it is practical. Okay, so REBT just don't stay in the therapy room, once a person learn how to identify and dispute their irrational belief, they can apply that skill in their daily life again and again. It's like giving them a lifelong tool for the emotional resilience. Okay. Second, it can empower the client. One of the beautiful thing about the REBT is that the client doesn't become dependent on the therapist. They learn how to become their own therapist. That means they walk out of the session with the real skills that they can use in their day-to-day life, to create the resilience in themselves and to cope up with the situations that cause triggers or that can create the problems in their life. Okay. Third reason is it works incredibly well for the common issues, for example, like anxiety, perfectionism, and even for the shame and the frustration. Okay. For example, yes, I had a client who believed that if someone is upset with me, I must have done something wrong. Okay. That one belief led to the people pleasing, overthinking, and the anxiety in that client. Okay. And by the use of the REBT, when I applied on that client, so she was able to challenge that thought and replace it with people can be upset, and that doesn't always mean that I did something wrong. It means it is about the situation and they have their own rights to think anything about that. I am not the only one who has to give them the justification all the time. Okay. And that small shift created a big emotional relief in that client and helped them to release or to cope up with that particular situation. Okay. Is this clear or any doubt till now? Okay, so moving to the next slide, the question that Rabia ma'am asked, that how REBT different from the CBT. Okay, so let's clear up something that often confuse the people, that how REBT is different from the CBT. If we work in both therapies, we work on the thoughts. Okay, so on the surface they seem very similar. Both deal with the thoughts and the feelings, but let me walk you through the difference point, as you can see in the table and with the examples. So first, the focus. CBT focus on the automatic thoughts, those quick surface level thoughts we have in response to a situation. For example, I made a mistake and everyone is going to think I am a stupid. This is kind of an automatic thought that I can have when I made a mistake. But in REBT, we focuses on the core irrational beliefs, those deep, those rigid beliefs that we have often carried for the years. Okay, these usually include the must, should, or have to the language. It's like, for example, I must always succeed. If I don't, I am a worthless, or I cannot do anything good in my future. So it's like having a must thing. So, in short, focus CBT focus on the automatic thoughts, and REBT focus on the core irrational beliefs that included must or should. Okay. Then second is the therapist style. In CBT, the therapist usually takes a collaborative approach. The therapist asks the question and helps the client to explore their thinking gently. But in REBT, the therapist is a bit more directive. They actively challenge the irrational belief, sometimes firmly, but always compassionately. For example, a CBT therapist might say, let's explore why you feel that way. And an REBT therapist might say that let examine the belief. Is it really logical or helpful? Okay. A third thing is the goal. So the goal of the CBT is to restructure the thoughts, making them more balanced and accurate. While the goal of REBT is to build both emotional and the rational resilience by letting go of the rigid, unrealistic beliefs. For example, in CBT, let's reframe this thought to be more accurate. And okay, we can, as a therapist, we can say this, but in REBT we ask our client that let's challenge that deeper demand behind this, like the idea that you must always be perfect. Okay. Fifth thing is the emotional views. That what are the emotional views in this, in CBT? We says that change your thoughts to change your emotion, while in REBT we say that accept that emotion are normal, but let dispute the irrational belief that are making making your condition more extreme. For example, in CBT we will ask like, you are feeling anxious because you are thinking of the worst case scenario, while in REBT we will say like, you are feeling anxious because you believe something awful must not happen, and that belief is making the anxiety worse. Is it clear that how it is different from the CBT on the different aspects?
Excuse me, ma'am. I didn't understand the last point.
The emotional view.
Yes.
Okay, so in the emotional view or in the emotional philosophy, CBT says that change your thoughts to change your emotion. Okay, like in the ABC triangle, we have learned about the thoughts, behavior, and the emotion, that how they are interchangeable or how these impact each other. So in CBT, we work on the thoughts to change our emotion, while in REBT, we accept that emotion. Okay, that it's okay and it's normal, but let's dispute on the irrational belief, the thought or the belief that we have, and that is making the case, or that is making the situation more extreme or more unbearable. Like for example, if you are like in CBT we can say that, okay, you are feeling anxious. Okay, anxious is like an emotion to them. So okay, if you are feeling anxious because you are thinking of the worst case scenario, but in REBT we say that, okay, you are feeling anxious because you believe that something awful must have happened. Okay, or something awful may have happened or may happen, and because of that because of that you are feeling very anxious, and because of that you have a belief that something bad will happen in the future. Now it's clear. Yes, Rabia ma'am. Yes,
Um,
Rabia ma'am.
so yeah, am I audible?
Yes.
Okay. So recently, I know. Okay. तो रिसेंटली मैंने एक स्टूडेंट के साथ उसने वो मेरे पास आई थी वो कंप्लेन लेकर कि उसके पेरेंट्स बहुत ही ज़्यादा डिस्करेजिंग है सो वेन एवर शी
Hmm.
ट्राई सम टू वर्क और वेन एवर शी कि अगर वो कुछ नया काम करने के लिए हड़ी हो रही है या फिर कुछ भी करने जा रही है उससे पहले ही उसको ये बिलीव आने ये थॉट्स आने शुरू होते हैं कि वो कुछ मैसअप कर देगी एंड एवरीथिंग विल गो बैड एंड बैड ओके वर्स तो मैंने उसको एडवाइस मतलब मैंने उस टाइम पे उसको ये सजेस्ट किया कि आप जब ये थॉट्स आपको वापस से आए तो आप उस टाइम पे अपने थॉट्स को चैलेंज करो चैलेंज योर थॉट्स
Hmm.
की ओके मैं मैसअप करूंगी बट स्टिल आई ट्राई वंस तो ये
Hmm.
आरईबीटी में आया या सीबीटी में आया
ओके, सो इसके अंदर जो क्लाइंट को बेसिकली बिलीफ है कि वो कुछ बुरा करेगी, तो उसको अपने ऊपर बिलीफ है कि हाँ, कुछ करेगी तो इट मस्ट बी, मतलब बुरा ही होगा, इट शुड बी बुरा। इट्स लाइक कि अगर मैं एक कदम भी चलूंगी तो पक्की बात है कि मैं गिरूंगी ही गिरूंगी। इस काइंड का बिलीफ है उसे,
या करेक्ट
या
कि
उसे,
हाँ
या
पेरेंट्स बोल रहे हैं कि हाँ ये नया काम मत कर क्योंकि तुझसे कुछ गड़बड़ी होने वाला है तो कुछ सही से करेगी नहीं तो डोंट डू
यस, सो
दिस
इट्स अ irrational belief that she have. Okay,
ओके
but when she is going for a one situation, like for example, if I have to take a presentation, and at that point I have a random thoughts, or automatically I have some thoughts that maybe you will buffer, and maybe there is a very bad situation, or your net will not work very well at the situation. This is an automatic thought, so this will come under the CBT. With the REBT we also deal with the emotive part. We accept that emotion, that it's okay, I have this emotion, we accept it as it is. But in CBT we challenge it. It's like, it's okay if I am feeling angry, why I am feeling angry. Okay, but in REBT I said it's okay to be angry. Now what are the beliefs that I have, because of that I am angry right now. Clear?
यस मैम क्लियर
Okay, Aradhna ma'am, you also raised your hand. Just a second. So REBT is more. Yes, we can say this. That's why REBT is different from the CBT. Okay. Because in CBT, we basically work on the automatic thoughts, we work on the core belief. But in REBT, on the irrational belief the client have because of the core beliefs. Clear? Okay. 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 So, in short, REBT goes deeper. It challenges those lifelong rules we carry and help us to break free from beliefs that create shame, guilt, anxiety, and the perfection. And that what make it such a powerful model, especially when it combined with the structure and the clarity of CBT. Now, what is the structure and the duration of the REBT? Okay, on an average, REBT take around 6 to 12 session, but of course, this depend on the client's need, the depth of their irrational belief, and how much they are able to practice outside the therapy. So, what happened in a typical REBT session? So, usually the session include a mix of few things. First is the psychoeducation. Psychoeducation means teaching the client about how their belief, their emotion, and their behaviors are connected with each other. So we don't just dive into emotion, we explain what's going on behind those particular thoughts, okay, or behind those particular emotion. Second is the ABCDE model. Okay, ABC model we have already learned in the CBT thing, that A is the activating event, B is the behavior, C is the consequence. So I will explain this in the further techniques. But in this, we walk client through this powerful tool to break down the emotional experience and challenge their belief. Okay, I will explain this more in the upcoming or in the next slide. Third thing is the active distribution exercises. Okay, so these are the exercises where we help the client to actively argue against their irrational belief using their logic, their evidence, and the compassion. Okay, next thing is the homework task or the practice task, like journaling, role play, mirror work, or thought logs. The idea is to take the session into the real life. For example, let's say a client say, I got rejected in a job interview, so that's mean I am a failure. Okay, so instead of just saying, don't feel bad, we will break this down with ABCDE model, challenge the belief that I must succeed or I am a worthless, and help the client to develop more rational belief like I really want this job, or it's okay to feel disappointed, but this doesn't define my worth. Okay, and maybe give them a should busting log to track how often they use the rigid word like must or have to. Okay, this is how we can understand the client situation and the triggers that he have in their day-to-day life. And in this way, each session become an opportunity for the emotional growth and the mental flexibility. Clear? Clear till now? Or am I going too fast? I know about ABCDE model that I will cover in the further slides. Don't worry about it. And the techniques that I just told, I will have a outro, a proper description in the further slides. Okay. So now, moving forward, then when and with whom to use the REBT. So, who can benefit from the REBT the most? Honestly, everyone. Everyone could be benefited from the REBT, but it is specially effective for the teens and the adults who deal with the anxiety or the emotional burst out, like perfectionism or even having the self criticism. Okay. Second, it could be the clients who overthink, who constantly worry about what other things, or who often say things like, I should be better by now, I must not make mistake, or people must approve of me, I should work hard, or I should get 100% score to get a admission in my college or to get successful in my future. Okay, so this is how For these people, REBT is very useful. So REBT help these client by untangle these unhealthy masks and replace them with a kinder and the more realistic one. Okay, it's beautifully works in one-on-one therapy session, even in the group settings like in school or workplace workshops, even in the coaching, especially for the high achiever or people struggling with the performance anxiety, and also in the psycho education program where we are teaching people that how to handle the thoughts and the emotion in their daily life. Okay, let me share a quick example with you. A teenager once told me, if my friend don't like my opinion, then I should just stay quiet, or I should not have a voice at all. Okay, so by using the REBT, we gently explored and challenged that belief, helping her to realize that disagreement doesn't mean rejection and her voice still matters. Okay, she doesn't just feel better emotionally, she also grew more confident socially. So that's the kind of transformation REBT can offer to your clients. Clear till now? Yes, ma'am. Darshana, ma'am.
Actually, ma'am, I have a question. Like, I did my internship in Thane Mental Hospital. So there were many patients who had rationalism. So for them, does REBT work?
Ma'am, your question was not clear. Can you repeat it?
Actually, I did my internship in Thane Mental
Hmm.
Hospital. So there were
Okay.
many major patients who had rationalism. So whenever we used to say anything, they used to give us a very logical answer for everything. So
Hmm.
with them, does REBT works?
Yes, definitely. If they are giving the logical arguments on a particular thing, then REBT can work with them, because in the REBT they have to challenge their thought logically. They have to give the evidences in against of the thought and in the favor of the thought, and this is how it's very easy for them to do it, and even help make them more aware that how to I can challenge that particular thing. I have
Uh,
one activity in for this thing that will make you understand about this, that how you can use this
no,
on
actually,
those.
I had tried with those kind of patients, but their beliefs are very scattered. They have different beliefs very firmly. There is not one single belief. There are many different beliefs associated with it.
Like for example, if you can tell.
So one of my patient, she was 16 years old. So
Hmm.
she was like, "Hey, everyone is just talking about me. Everyone is saying something bad about me. Or
Hmm.
wherever I go, everyone feel that I'm superior to them." So there are many multiple beliefs which she has, which is very rigid from childhood. So like
Hmm.
with that kind of a patient, we have to work with every belief, I think so.
Okay. So as you told me these things, how is the self-esteem of the client? Is this moderate or very low?
Actually, the self-esteem differs. Like for a month, she is at a very higher self-esteem, then she is at a very lower self-esteem.
Okay. Okay. It's okay. And what are the major emotion that she carry around herself? What she
She
literally
uh,
feel about herself?
okay. So sometimes she literally like question everything in her life. If someone is doing something for her, that also she question. He might be wanting something from me or anything like that.
Okay. So is there anything that happened in the past and because of that she has this belief?
She was like कि her mother was like that, but her mother died, and after that she was like कि my mother used to question everything, and she has all these beliefs, and she didn't get answer, so I also have that same beliefs.
Okay. So it's more about the generational thing. In this, you can use the REBT. That will work with her, but not right now. She have to think about herself from her perspective. Okay, for this you can use some activities, art-based activities, or some self-esteem activities in which she can have a proper reflection of who she is. And after that, you can give these approaches to her.
Okay,
Okay,
okay. Thank you
like
so
for
much.
example, yes, like for example, you can give her like a tree of strength and weaknesses. That what are your strength, what are your weakness. Even if the you can give her the activities like the real self and the ideal self. What is your ideal self? What are the qualities that you have? And after that, you can give some mindfulness activities or some art based activities like mandala or something like this, so she can have a proper emotional thing. Okay, she can work on the emotion first, and then you can start working on each thought, not to work with every thought every single time, because this can might have a relapse in the client. Okay,
Okay, okay.
expressive art therapy maybe work with this client very well. And after that, REBT, even the motivational interviewing you can use on her, because in motivational interviewing, that is a very good technique, comes under the person centered therapy. And that is basically for the clients, majorly it is used with the clients having the substance abuse disorder, because they are very rigid with their thoughts. Okay, so even MI can help her. Okay,
Okay, thank you
uh,
so much, ma'am.
yes, Darshana ma'am. I hope that that is by mistake. So there was one question that can we use REBT with the clients having OCD? So yes, absolutely, REBT can be used with the OCD, and it can be quite effective with them. Okay, but you have to use it very thoughtfully, because they have a compulsive behavior and a repetitive thought. So we have to work with them very carefully. Okay, let me explain how. So OCD is often driven with the rigid irrational belief, like I must have complete certainty or something terrible will happen, or if I don't do this ritual perfectly, I am a bad person, or I have to wash my hand again and again and again, so that no germs can harm me out. Okay, so these are some rigid or the irrational belief that the client have. So now in REBT we target exactly these kind of must, should and have to beliefs. We help the client to recognize that the thought itself doesn't make them bad, and they can learn to tolerate the uncertainty instead of trying to control it from the compulsion. Okay, like for example, if a client check the door lock 10 times, the belief might have that I must be 100% sure or I will be unsafe. So in REBT we challenge that by saying, is it logical to expect 100% certainty in the life? Can you guarantee me that if you check your lock 100 times or 1,000 times, no one can break it out to reach in your home? So it is it logical? Second thing, is this helpful to live with the this level of fear? Okay, what is more realistic belief that you can have? Okay, so this is how we can help with the clients having the OCD. Even along with the REBT, you can use the exposure therapy, exposure response prevention therapy. That is very helpful with the clients having the OCD. In this, we give them a gradual exposure to the fear that they have, but from the basic to the highest thing, so that they can be comfortable with that fear. Is this clear now? Clear till now? Okay. So moving to the next topic, that integrating the REBT with the other approaches. So in this, we will understand that how we can integrate or merge 2 or 3 different psychotherapies, especially with the REBT in our session, so that it's easy for us or for the client to work with along with it. Okay. So just a second. Yes. So first therapy, that is mindfulness. So before jumping into the disputing irrational belief, we can first help the client to observe their thought mindfully without any judgment. This create the emotional distance, and it actually strengthen the REBT work, because sometimes when the client come to us, they have the irrational belief, and also with because of that irrational belief, their mind body connection is completely broken. So before or directly jumping onto the thoughts, we can have a proper mindfulness session in which you can give your clients some mindfulness activities like deep breathing or guided meditation, or even some activities like PMRT or autogenic meditation or something like this. And after that, you can start with your REBT techniques in which you will challenge the disputed belief. Okay. Now the second therapy, that is the narrative therapy. So in this, we can help the client to externalize their irrational belief by turning them into the stories that they tell themselves. Okay, like this therapy can also be used with the teenager client that we have discussed before. Okay, you can also use the narrative therapy on that client. For example, a belief like I must be perfect become strong that they have been told in their childhood by their parents or by someone else, and because of that they have that belief that I must be perfect. And now by using the narrative therapy with the REBT, they have a chance, or they got a proper space to rewrite that story with a healthier narrative. Okay, and to build a new narrative about themselves that can serve them in a positive manner. Third therapy is the person centered therapy. So before challenging a belief, we can offer a unconditional positive regard, so the client can feel safe and comfortable around the therapist. And when they know that they are accepted, they are more open to changing their thoughts. Even sometime when the therapist try to confront them or try to challenge their thoughts, they will not get triggered by it, because they have a rapport and they have a kind of understanding in between the therapist and the client. Clear till now? These three therapies are clear? Or anyone? Example of narrative therapy. Okay. Hmm. Example like what? About the what is narrative therapy, or how to incorporate narrative therapy with the irrational belief with the REBT? Do you want me to both? Okay. So have you know about what is REBT? Sorry, what narrative therapy is? Okay. Okay, I will go slow. So anyone who have the knowledge that what is narrative therapy? Anyone else? Yes, Priya ma'am, Radna ma'am, anyone of you can say.
Ma'am, as I know, in narrative therapy, we use stories or like mythological story or any stories that
Hmm.
can help client to understand their beliefs or their emotions, and to help them resolve their issues.
Okay. Radna ma'am, anyone else?
There is one scene in Dear Zindagi where Shah Rukh Khan used the narrative therapy to explain the Arya her situation.
Okay. Okay, so a little bit of the things are correct, but what exactly is narrative therapy? Yes, we use the stories, but not the other stories. We will tell the client to write their life as a story or from the third perspective, so that they can externalize the thoughts or the beliefs or their life onto a paper. They can do it in the form of a timeline in which we just draw one line and we will write the different things, or even in a proper stories. Like for example, it's like I'm seeing a movie, but in that movie the story is about my life. Like what was I in the childhood, how I do in my childhood, what are the things that I did in my childhood. Okay, everything is there on the paper, but from the third perspective. It's like there was a girl named Ria. She is very good in the studies, Okay, she have completed her class 10th from this college, sorry, this school. She has these kind of friends, and from that friends, the friends think this about the Ria, and because of that they have a proper conflict, and then she get into a relationship, and now she has a trauma of 9 years of the relationship. Now she's suffering from the grief trauma or something like that. Okay, like I am writing my story from a third perspective, and this is how I externalize it. And after when I externalize it, then I will find out the main thoughts or the irrational belief, the core belief that I have about myself, and then I again rewrite that story, but from the positive aspects or from the aspect that can serve me out. Like for example, in this aspect, I told that I have a friend's conflict, I was bullied in at that point, I have a relationship trauma, I have a different traumas. At this point, everything is negative is in front of me. Now I rewrite it and write the positive aspects too. Like for example, if I'm suffering from the bullying, at that point I got a senior who supported me in my studies and helped me out to get better or to do good in my life. Okay, this is how I convert or I shift my perspective only from the negative to the positive thing. Okay, this can be used in the existential crisis. We will definitely have a proper workshop on narrative therapy. Okay, so now when we
एक्सक्यूज मी मैम.
properly externalize, yes,
हाँ मैम, इन शॉर्ट जो हमारी नैरेटिव थेरेपी होती है उसमें
yes,
हम क्लाइंट को और क्लाइंट की प्रॉब्लम्स को दोनों को अलग अलग कर देते हैं, राइट? क्लाइंट,
हम कह
हाँ,
हम क्लाइंट,
क्लाइंट अपनी प्रॉब्लम्स को, अपनी लाइफ को, उसके साथ क्या हुआ, जब बुरा चल रहा था, जब अच्छा हो रहा था, तब उसने अपनी प्रॉब्लम्स को कैसे डील किया, वो सब कुछ लिखता है.
करेक्ट, बट हम उसकी जो पूरी स्टोरी है ना, हम उसे एक्सटर्नलाइज करवा देते हैं, हम उसकी
राइट.
पूरी स्टोरी को उसके फ्रंट में रखवा देते हैं, एंड देन वी विल गिव देम अ डिफरेंट एस्पेक्ट्स. लाइक फॉर एग्जांपल, आई वाज बुलीड एट दैट पॉइंट बिकॉज ऑफ सम थिंग्स, फॉर एग्जांपल बिकॉज ऑफ माय ड्रेसिंग सेंस. एट दैट मोमेंट आई कैन नॉट डू एनीथिंग, बट नाउ आई कैन चैलेंज दैट थॉट टू समथिंग पॉजिटिव. Okay, so it's like I'm externalizing my whole story, and now I am rewriting it with a positive or with a good aspects that can serve me out. And even if I have any trauma, if I have anything that is suffering, or even the childhood traumas that I have, I can rewrite it or work on them one by one.
राइट, मतलब जो पहले प्रॉब्लम हुई थी हमारे साथ, सब एग्जांपल, लाइक एग्जांपल के एक एग्जांपल, जैसे कि
Bullying हो गया.
मेरे गुस्से की वजह से मेरे रिश्ते खराब होते हैं, राइट?
हम्म.
तो एक एग्जांपल है कि मैं बहुत गुस्सैल हूँ, आई एम अ वेरी वेरी गुस्से
हम्म.
वाला पर्सन. तो अगर मैं इसको नैरेटिव करूँ इन अ थर्ड पर्सपेक्टिव, तो
हम्म.
मेरे गुस्से की वजह से मेरे रिश्ते खराब होते हैं. दैट मीन्स मैं अलग हूँ और मेरा गुस्सा अलग है. अब मुझे पता है कि मेरा प्रॉब्लम मेरा गुस्सा है, राइट? तो
हम्म.
अब एज अ थर्ड पर्सन आई हैव टू वर्क ऑन माई एंग्री, ताकि मैं अपने एंगर पे वर्क करके अपने रिश्तों को ठीक कर सकूं. इट इज कॉल्ड नैरेटिव थेरेपी, राइट?
Correct. You can say this, and along with that, we can work on the face, or we can ask the client that what are the reasons that you say that you are angry? Is there any incident and why? Because childhood में जब हम 2 साल के होंगे तब तो हमें गुस्सा नहीं आता होगा ना. तो at that moment ऐसा क्या होना start हुआ कि आपको वो गुस्सा आना start हुआ, and now you are the angry person. Is there something more hidden about it? Okay, we can have a more backstory like that.
तो मैम ये तो फिर नैरेटिव के साथ सीबीटी अलोंग हो जाता है ना?
Yes,
अगर,
this is why this is
हाँ.
what we are doing in narrative therapy. We are externalizing our story, and with the help of the REBT and CBT, we are correcting it in a good way so that that can help us in the future aspects.
राइट,
Okay, that will not hold us.
राइट. तो मतलब
Okay, like
ऑटोमेटिकली नैरेटिव के साथ सीबीटी भी चला जाता है और आरईबीटी भी थोड़ा थोड़ा इंक्लूड हो जाता है अगर इरेशनल बिलीव्स वो होते हैं तो, राइट?
yes.
ओके.
Okay, yes, Riddhi ma'am.
Ma'am, so in that case, like you said, no, that in case of bullying narrative analysis, so if a child is saying कि मुझे school नहीं जाना है because बच्चे मुझे तंग करते हैं and that is because of my dressing sense, how do we do narrative analysis before REBT for this one?
How we will do?
नरेटिव एनालिसिस लाइक आरईबीटी तो चलिए चैलेंज कर लेंगे कि बच्चे क्यों बुली कर रहे हैं वगैरह वगैरह, बट इफ द चाइल्ड थिंक because of their dressing sense, or something is wrong with the school because of which they are bullied and they don't want to go to school. तो इसमें narrative analysis कैसे fit हो?
मैम इस पर्टिकुलर केस में नरेटिव यूज ही नहीं होगा, इट्स बिकॉज ऑफ वन इंसिडेंट। आई
Okay.
जस्ट गिव एन एग्जाम्पल। मुझे उस समय कुछ याद नहीं आया तो एक होता है ना, मैंने बोला वो।
हाँ, तो मैम आई थिंक इट वुड बी बेटर अगर ऐसा हुआ कि एक इंसान को सेल्फ एस्टीम इश्यूज हुआ एंड थ्रू नरेटिव एनालिसिस में भी पता चला कि ऐसा कुछ बुलिंग वगैरह हुआ था स्कूल में, जिसकी वजह से अभी वो ऑटोमेटिक थॉट है कि आई एम नॉट क्लियर व्हाट। आई थिंक देन
यस,
नरेटिव एनालिसिस वुड कम इन प्ले।
yes, right now, like for example, right now in this age, I also felt less confident while dressing up. For example, if I felt less confident, and because I have that incident in my mind, that because I was bullied in that moment, I was extremely bullied. I don't want that thing. So because of that, right now I am feeling this thing. At this point, the narrative therapy can help. Then you can rewrite that from the client's perspective, or you can allow your client to challenge that particular incident, okay, in the form of a story. Like they have to write a story. Like for example, if I'm the main character, then what can I do at that moment? Now what can I do with that thing? Is it clear?
Yes.
Don't worry, we will have a proper thing on the narrative therapy. At that moment, you will understand that how to use the narrative therapy and with the different psychotherapies, not only with the REBT, but also with the different psychotherapies. But is it clear till now that what is mindfulness, narrative therapy, and person-centered therapy, and how REBT can be used with these things?
एंड
Okay.
एक्सक्यूज मी मैम, यस वन मोर थिंग मैम, सीबीटी में हम लोग एविडेंस ढूंढते हैं, राइट? जो क्लाइंट
Yes.
का थॉट्स है उसके अगेंस्ट और उसके इनसाइट में एविडेंस क्या है। अगर वो ऐसा सोच रहा है तो उसका एविडेंस क्या है कि वो ऐसा क्यों सोच रहा है, राइट?
जी।
और हम आरईबीटी में उसके मस्ट और शुड पे वर्क करते हैं,
Yes.
उनके थॉट्स को चैलेंज करते हैं, राइट? मतलब हम
Yes.
सीबीटी में तो रिकंस्ट्रक्ट कर रहे हैं एविडेंस को ढूंढकर, और आरईबीटी में हम लोग चैलेंज कर रहे हैं उनके बिलीव्स को और उनके माइंडसेट को चैलेंज करके उनका माइंडसेट चेंज कर रहे हैं, राइट?
Yes, you can see the core rigid beliefs that I have. It's like when जब हम बच्चे थे तो हमारे को एक ये था, हम कभी कभार गेम्स खेलते थे, हम कहते थे कि हम स्टेपो बनाकर खेलेंगे, एंड अगर हमारा जो पैर है हमारी लाइंस पे आ गया तो वी विल नॉट गेट सक्सीड इन आर फ्यूचर। सो दिस इज काइंड ऑफ वन थॉट दैट वी हैव। बट जब हम इस स्कोर को एकदम इंटरनली, जब हम सॉरी इस थॉट को इंटरनली कर लेंगे, या हम हर चीज में इसी चीज को करते रहेंगे कि यस अगर मेरा पैर उस पे पड़ा, लाइन पे पड़ा, आई विल नॉट गेट सक्सीडेड, आई एम अ कंप्लीट फेलियर, एंड बिकॉज ऑफ दैट now I am not challenging that thought, I am not doing that thing, and because of that I am feeling very anxious and I don't do anything. It's like an irrational belief that I have at that moment. Okay,
राइट।
so this comes from my childhood thing, या बहुत पुरानी चीजें है जो वो in depth कर गया है मुझे। ओके, सो वी वर्क ऑन दीज काइंड ऑफ थॉट्स। जब हम इन पे काम करते हैं तो वो हम आरईबीटी अप्रोच में करेंगे, नहीं तो वो सीबीटी हुआ। इन आरईबीटी 2 हम उनको भी, उन थॉट्स को भी चैलेंज करते हैं, हम उन थॉट्स के ऊपर भी काम करते हैं। ओके, ऐसा नहीं है कि हम नहीं कर रहे। इट्स लाइक आरईबीटी एंड सीबीटी काइंड ऑफ एक ओवरलैपिंग थिंग है, बहुत ओवरलैपिंग है। इनपे मेजोरिटी चीजें जो है वो आपको सिमिलर मिलेगी। तभी इसमें आपने एक वर्ड नोटिस किया होगा, इमोटिव। सीबीटी के नाम में आता है कॉग्निटिव बिहेवियर थेरेपी। कॉग्निटिव आर आर थॉट्स, बिहेवियर आर द बिहेवियर्स, एंड थेरेपी इज द थिंग। इन दिस वी आल्सो वर्क ऑन द इमोटिव पार्ट। ओके,
ओके,
नाउ क्लियर?
या
Okay, so I know it's yes, Radha ma'am. Radha ma'am, yes.
Ma'am, do we use narrative therapy
Ma'am, you are not audible. आपका voice break हो रहा है।
story in present scenario or like from the past? Like rewrite whole story or like current
Whole
scenario?
story. Whole story. We'll rewrite the whole story, not one incident. Okay.
Okay.
So now let's move forward. Yes, Rabia ma'am.
सॉरी फॉर अगेन बट ओके सो सीबीटी में ऑटोमेटिक थॉट्स आते हैं बट हमारे पास जब क्लाइंट आता है तो वो बिहेवियर कंसर्न्स लेकर आता है कि हाँ मेरे ये इश्यूज हैं करेक्ट और हम उसके बिहेवियर कंसर्न के जो भी उसका बिहेवियर इशू है उसके पीछे हम जो उसके थॉट्स है उस टाइम पे कि हाँ अगर ये गड़बड़ हो रही है तो इस सिचुएशन में आपको थॉट्स क्या आ रहे हैं मे बी वो थॉट्स आपके बिहेवियर को अफेक्ट करे बट इन आरईबीटी में फॉर सम टाइम यू नो क्लाइंट को पता हो कि हाँ ये इरेशनल बिलीव्स जो है यही अफेक्ट कर रहा है ऐसा बोल सकते हैं
एक सेकेंड, क्लाइंट को पता हो ऐसा हो, मैं समझी नहीं। ये तो मैं समझ गई कि क्लाइंट को ऑटोमेटिक थॉट्स आते हैं, सीबीटी में
हाँ
हुआ, हम उनके बिहेवियर्स पे काम करते हैं। आगे का क्वेश्चन मुझे समझ नहीं आया, कैन यू प्लीज रिपीट?
सो व्हाट आई एम सेइंग कि क्लाइंट हमारे पास आता है तो वो डायरेक्टली अपने इरेशनल बिलीफ के लिए तो नहीं आएगा वो आएगा अपने बिहेवियर कंसर्न्स लेकर कि हाँ मुझे ऐसा परफेक्शनिज्म की वजह से मुझे ये डिफिकल्टीज आ रही है तो अगर क्लाइंट हमारे पास ऐसे सारे प्रॉब्लम्स लेकर आ रहा है तो अगर लेट्स सपोज कि तो सीबीटी अगर हम लोग सीबीटी के पॉइंट ऑफ व्यू से देखें कि उसको ऑटोमेटिक थॉट्स आ रहे हैं तो मे बी अगर प्रेजेंटेशन देने खड़ा हो रहा है या फिर कुछ भी करने खड़ा हो रहा है तो उसको ऑटोमेटिक थॉट्स आ रहे हैं कि हाँ ठीक है आई एम मेस्ड अप तो ऐसे टाइम पे हम उसके ऑटोमेटिक थॉट्स पे काम करेंगे कि ठीक है उसको पैनिक फील हो रहा है क्यों क्योंकि उसको ऑटोमेटिक थॉट्स आ रहे हैं इसलिए तो हमने
यस,
वो रूट कॉज निकाला कि हाँ ठीक है उसको इस वजह से आ रहे बट इन आरईबीटी कैन वी से कि क्लाइंट को पता होता है समटाइम्स कि हाँ ये बिलीफ ही मेन प्रॉब्लम है अगर ये बिलीफ चेंज नहीं हुआ तो फिर मुझे और भी प्रॉब्लम्स क्रिएट हो सकती है इसके वजह से तो मेरा मेन प्रॉब्लम ये बिलीफ है और आई नीड टू चेंज दिस बट मैं अकेले नहीं कर पा रहा हूँ कैन वी से दिस
not in all case, in majority of the cases no, client don't know, even he or she doesn't know कि उसके पास इस तरीके के rigid beliefs हैं। Like for example, आपने ज्यादातर मेजोरिटी क्लास 10th के बच्चों को देखा होगा पढ़ते हुए। ज्यादातर बच्चे पढ़ते हैं, उनको पता है मुझे अच्छा स्कोर करना है। क्यों? क्योंकि अगर मैंने अच्छा स्कोर नहीं किया, if I didn't score good, I will not get a good college. Okay, this is kind of a belief they have. And when जब भी वो पेपर देने जाएंगे उनके पास वो डर रहेगा, वो बिलीफ रहेगा, अगर मैंने इस समय अपना बेस्ट नहीं दिया या मुझे अपना बिल्कुल बेस्ट देना है, अगर मैंने कुछ नहीं किया या मैंने अपनी पढ़ाई छोड़ दी या मैंने इस समय कार्टून पे ध्यान दिया या मैंने एक्स्ट्रा करिकुलम दिया, so I am a complete failure. ओके, सो दिस काइंड ऑफ द इंसिडेंट्स दैट यू हैव इन आरईबीटी, हमें क्लाइंट को ऑब्जर्व करना होता है कि क्या वो ये मस्ट और शुड वाले स्टेटमेंट यूज कर रहा है अपने डे टू डे लाइफ में। लाइक फॉर एग्जाम्पल, मैं ये कह रही हूँ कि मुझे 100% ही स्कोर करना है, अगर मैंने 100% स्कोर नहीं किया तो मेरे को अच्छा कॉलेज नहीं मिलेगा, मैं फेलियर हो जाऊंगी। परसेंट पे भी अच्छा कॉलेज मिल जाएगा मुझे, 80% पे भी अच्छा कॉलेज मिल जाएगा, बट आई हैव अ बिलीफ, इस बिलीफ को मैं ही नहीं कर पा रही, एंड इसी बिलीफ 24 घंटे मैंने खाली पढ़ना स्टार्ट किया, इसी के वजह एंड बिकॉज ऑफ दैट मेरे बिहेवियर एंड इमोशनल कंसर्न्स आ रहे हैं। द रूट कॉज इज दिस बिलीफ कि मुझे 100% स्कोर करना है। सो दिस इज व्हाट द इरेशनल बिलीफ इज। होया, आया समझ?
या मैम
एंड नाउ
या क्लियर
अब मैंने अपने 10th किया, अब मैं 12th में भी सेम एंशियस हो रही हूँ, यही मेरे कॉलेज में भी पैटर्न चल रहा है, यही मैं जब कोई कॉम्पिटिटिव एग्जाम देने बैठी सेम आया कि अगर मुझे ये पर्टिकुलर ग्रेड नहीं मिला या मेरा फर्स्ट रैंक नहीं आया तो मुझे अच्छा नहीं कॉलेज मिलेगा या मुझे अच्छी जॉब नहीं मिलेगी, मुझे अच्छी पोस्टिंग नहीं मिलेगी। वो एक बिलीफ कि मुझे एक्सेल करना है नहीं तो मैं फेलियर हुआ। बट इन ऑटोमेटिक
यस मैम
थॉट्स आई हैव थॉट कि ओके, अगर मेरे को कम नंबर आए तो व्हाट कैन आई डू, क्या होगा, कैसे होगा, मैं बुरा ही करूंगी, मैंने पढ़ाई कम करी है, मैं वहां पे अपने आप को एक ऑटोमेटिक थॉट्स दे रही हूँ। वी ऑल्सो हैव मेनी ऑटोमेटिक थॉट्स जो नेगेटिव हमें आते हैं, बहुत सारे सिचुएशंस पे आते हैं। ओके,
यस
automatic
मैम
thoughts can be controllable, but irrational beliefs are the deep rooted beliefs that the client have, and maybe it could be developed from the childhood. लाइक इन मेनी मूवीज यू हैव सीन कि बहुत सारे जो विलन्स बनते हैं वो बनते ही उस एक चाइल्डहुड चीज की वजह से हैं। लाइक इन केजीएफ वी हैव सीन कि क्लाइंट को एक चीज दिमाग में आ गई या उसको एक चीज समझ में आ गया कि अगर मेरे पास दुनिया का सारा सोना नहीं होगा तो आई कैन नॉट डू एनीथिंग, या मेरे लिए कुछ अच्छा नहीं है। तो इसीलिए वो पूरी अपनी लाइफ एक खाली सोना इकट्ठा करने में लग जाता है कि मुझे दुनिया का सारा सोना चाहिए। इट्स ओके, इट्स अ मूवी रिप्रेजेंटेशन एंड एवरीथिंग वाज लाइक, लेकिन दैट इज द कोर इरेशनल बिलीफ दैट ही हैव। अगर उसके पास वो दुनिया का सोना नहीं होगा तो वो एंशियस होगा, उसके बाद वो उसके लिए कुछ भी करेगा, चाहे उसके लिए मारना हो, चाहे मरना हो, चाहे कुछ भी हो। सो दिस इज द इरेशनल बिलीफ जिसकी वजह से वो ये सारी चीजें कर रहा है। नाउ क्लियर?
Yes, ma'am. Crystal clear. Thank you so much.
Welcome. So moving to the next thing. Any other doubts? Otherwise, we can move with the expressive art therapy and how to integrate REBT with that. Okay. So in expressive art therapy, um, uh, in this, client can draw or act out their beliefs and then we help them to dispute them creatively. It is especially useful for the younger client or those who are non-verbal. Okay. In this, we use the expressive mediums to find out the core beliefs or the disputive beliefs that the client have, and with the expressive medium too, we try to challenge them. Like for example, we can ask the client to draw the beliefs or to draw their perfect picture, and then we can ask them to draw their current picture, and then this is how we can create a dispute. And we can ask the client that how he or she can reach from their normal self to the ideal self. This is kind of the things that we can ask the client in the form of the expressive medium, in which we use art, even dance, photography, or even we can use the drawing or doodling, scribbling, any other medium that we used. Okay. Now, the next thing is the SFBT, that is solution focused brief therapy. So, REBT rational thinking tools can be used to build the exception and shift the attention to the solution. For example, if a client say that nothing ever works out for me, so REBT helps them to challenge always or never thinking, and SFBT then helps them to find one time something did work and build from there. Like, oh, for example, okay. 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 I don't find an example for this right now. Okay. So in short, if a client say anything or any thought, in REBT we challenge that thought, and with SFBT we help the client to find the exception or the solution for that irrational belief, and work again and again and again on that particular thing so that he can achieve, or he or she can replace the irrational thought with the rational one. So this is how we can incorporate or we can integrate the different therapeutic approach with the REBT. Clear till now? Okay. So Ridhima, in SFBT, we basically focus on the solution, that what are the main solution for the issue, instead of just focusing on particularly on the past thing. We worked on the solution, that now what we can do for that particular thing. Okay. And in SFBT we find the exception in the past that we have for that particular thought or for that particular behavior. Like for example, if I am anxious day long, then in the day there could be a time when I am happy or I am feeling less anxious. I have to find that time and what exactly I am doing at that moment, and then I have to do it again and again and again, so that the problem that I have doesn't exist. So with the SF, just a second. So with the REBT, we can first challenge that thought that we have in the past, or that the thought that is stopping us to do something good in the future. And when we challenge that irrational thought and rewrite it with a good thought, and then we can build the exception and focus on the solution. Like for example, if I have a thought that uh, I cannot study when I am in a group. But when I have a headphones in my ears, I can easily listen to a music and I am very comfortable while sitting in a group or while studying in a group. So this is the exception thing that I have. This is what I find from the SFBT. Now I can challenge my thought that I cannot sit with my that I cannot sit with the group, or I am very inferior to, I must do something good in to sit there. I can challenge this thought with the REBT and then use the music thing in my ear to to sit in that group and to work good or to have a proper conversation in that group to feel more comfortable. Now clear?
Yes, ma'am.
Just a second. Okay. Okay. So now the role of the therapist in the REBT, that what is the role of the therapist in this. So so in this, you are not just a listener, you are also a teacher, a guide, and a compassionate challenger. Okay, the challenger who will challenge the thought in the first place for the client, because sometimes the clients don't have a proper instinct or they don't know how to challenge them in a properly manner. So you have to be a challenger for them. So your job as a therapist is to first to spot their irrational belief, especially the sneaky should, must, and have tos. Okay, this is what we can find when we have a proper conversation with the client, and we can observe whether they are using the must, should, or have to words or not. If yes, we can write it down and also ask the client to write down these things. Okay. Second thing is to dispute those beliefs. Okay. Um, in this, we have to dispute those beliefs using the warmth, the logic, and the real life evidence. Okay, the third thing is to teach the emotional responsibility, meaning the client learn to say that I am feeling this way because of what I believe, and I have the power to change that particular thought. Okay, so this is how we have to teach the emotional responsibility to the client. Now, here's the key. Even though the REBT involves the challenging client, it should never feel harsh. The tone should be firm. The tone should be firm but have to be kind. We don't say you are wrong. Instead, we say, let explore this belief. Is it helping you or hurting you? Okay. For example, I have a client or a client says to me that if someone criticizes me, it means that I am a failure. Okay, so instead of saying that this is a rational belief, we gently ask the client that is that always true? Is it helpful to believe that? And what would you say to a friend who had this belief? Okay, this is how we are giving them a proper way, or by doing this Socratic questioning, this will help the client to challenge their own thinking, and that's far. Yes, yes, Radha ma'am.
Ma'am, do we focus on emotional part in REBT and CBT? Like, do we ask how you feel about it, or like how does that felt in that moment?
Mm. Ma'am, I didn't get your question. Can you please repeat?
Ma'am, I mean to say that do we ask or focus on the emotional side of the issue? Like, do we ask the clients that how do you feel about it, or how did you felt about it in that moment, or just on the behavior or thought thing?
You should work on the emotive part also. You should ask your client how they feel, why they feel. Because of that, you can understand the underlying thoughts that they have. Maybe it is not from that particular moment, it is from any past trauma or any past thing that is triggering right now. And because of that, they are acting in such a way. You
Okay,
should
in
ask.
REBT and CBT both, or just in REBT?
In REBT. In CBT, we
Okay,
basically work with the cognition and the behavioral part.
okay. Thank you.
Yes, in CBT we feel like that our thoughts build our emotion, and our emotions our behavior works. Okay, but in REBT we accept the emotion as it is, that it's okay. Now it's the we have to work on the our thought part.
Okay, got it.
Yes. Hmm. Okay. So in this, the role of the therapist, what is the role of a therapist in REBT? Is this clear? Just remember that in REBT, you are working as a mirror to a client, not as a hammer. You reflect the irrational thinking back to the client in a way that invites them to rethink and the grow with the safety, not with the shame. Okay, we don't have to trigger the client. We have to work responsibly so that they can see and they can, and together we can work on that particular thought. Okay. Now, the main part of the presentation, that is the ABCDE framework. Okay, now let's dive into the heart of REBT. This is basically the heart. This is the main technique also that we use basically in the REBT. That is in ABCDE, where A stands for the activating event, B is the belief, C is the consequences, D is the disputation, and E is the effect. Now let's break it down. So A, the activating event is, this is what happened. Okay, a situation or a trigger. This is what the activating event is. For example, I was left on read after sending a message. Okay, like I have sent a message to my to someone. They have read a message and they just seen it and didn't reply me. Okay, this is the activating event. Now the belief is the, this is what the person told themselves about the event. For example, they don't care about me, I must be boring or annoying. Okay, they are interpreting the situation with this belief. Now C is the consequence. So this is the emotional and the behavioral outcome that the client do. For example, they feel rejected, anxious, and they avoid the further messages from the particular person. Okay, and now, up to this point, this is how the most people experience the distress. They think A to C. Okay, this is what we also do in the CBT thing, ABC framework. But in REBT, we teaches them that it's not the event, it's the belief, and that causes the emotional consequences. Okay, so this is not the activating event. This is the belief, and because of that, I have a particular consequence. And now we will work on the D part. So D is the disputation. This is where we challenge the belief. We ask the question like, is this belief logical? Is this based on the fact? Is this helpful for your life? Okay, we will try to dispute with them with that belief logically. And then E is the effect. This is the new rational belief and the more peaceful and the empowered emotion that follows. For example, maybe they were just busy, that's why they didn't reply, or my worth isn't defined by one message. Like if someone didn't message me, it doesn't mean that I'm worthless or I'm not important to anyone. Okay, so the new emotion might be calm, acceptance, or even the confidence. Okay, this model is incredibly useful, not just for the therapy but even for the kids, teen, or adults who want to build the emotional strength. Also, you can print this on a worksheet and give them in the journaling format to your client, and this will it's like a mental detox, helping the client to move from the emotional chaos to the rational clarity. Is this clear now, that what is ABC and what is D and E means? Yes, Priya ma'am.
Ma'am, like there's example, there is a belief, मैंने ठीक से पढ़ा नहीं, I must be fail. राइट, ये
Hmm.
इरेशनल बिलीव है उसका। एज अ उसको एंशियस फील हो रहा है, नर्वसनेस फील हो रहा है, या जो भी फील हो रहा है, मतलब उसकी कॉन्सिक्वेंसेस जो उसको फील हो रहे हैं। अब फोर्थ पॉइंट आता है कि एज अ थेरेपिस्ट मैं उससे क्या पूछूंगी। अगर मैंने इससे पूछा कि ऐसा पहले कभी हुआ है कि आपने ठीक से पढ़ा नहीं, उस टाइम आप पास हुए या फेल हुए। अब इसमें हमारे पास क्लाइंट से दो आंसर आ सकते हैं कि हाँ मैं फेल हुई हूँ, ऐसा पहले भी वो है, नहीं मैं फेल नहीं हुई हूँ। राइट,
Hmm.
तो हम उनसे अगर
Okay.
यस के साथ जाएंगे हम लोग, इफ क्लाइंट से यस, तो उस टाइम
Hmm.
आप ये पूछ सकते हो कि हाउ कैन यू से
Hmm.
दैट कि इस टाइम भी आप फेल नहीं होंगे, इस टाइम भी आप फेल हो जाएंगे। तो उन्होंने बोला कि हाँ मैं पहले भी फेल हुई हूँ।
Hmm.
राइट, तो मैं उनसे ये पूछूंगी ना कि उस टाइम
Hmm.
जब फेल हुए थे आपने क्या किया, राइट, जो आप इस पॉइंट पे इस टाइम इतने सक्सेसफुल हैं, राइट। तो मैं उस टाइम मैंने ये पूछा कि
So right.
हाँ, तो उस टाइम मैम ये वाली जो REBT है हमारी सॉल्यूशन फोकस पे चली जाएगी क्या थेरेपी, कि उस टाइम आपने क्या किया था, उस बिहेवियर को हम लोग दोबारा करेंगे इस बिलीफ से बाहर निकलने के लिए, तो ये सॉल्यूशन फोकस बेस्ड
Yes,
थेरेपी
you can do.
कन्वर्ट हो जाएगी?
Yes. बिकॉज इन REBT अगर ये सिचुएशन रहती कि क्लाइंट आता और क्लाइंट ये कह रहा है कि कल मेरा एग्जाम है या मेरा एग्जाम आने वाला है एंड आई मस्ट बी अ फेलियर, I
राइट।
didn't study and I must fail, then I can ask the client, okay, so what are the evidences that can say that you didn't study? Okay, did you really study or not? Okay, did you practice? What are the things that we can do now? This is how we are breaking that belief. And also we can add this question that, okay, if you, as you say that you may be a failure or you will fail this exam, what will happen if you fail and how it can impact you? Okay, this is how we are disputing that belief that the client have. Okay, in solution focused brief therapy, that what you have told, we work on the solution, that
राइट।
what they have done in the past, or what they have done or what they can do this time to face that particular thing. But in this, in REBT, we work or we challenge that thought that they have.
Ma'am, it
Okay,
depends on the client's answer, right? What the client answered us.
it, yes, and also on the therapist question, because your first question when you ask from this that what are the evidence, or is this something happened to you in the past? This is the
Yeah.
question. Because of that, we already focused on the past events. Okay, we already focused on the things. We didn't focus on the thoughts that they have.
Okay.
Okay, this is how, as a therapist, you shifted your focus from this therapy to the other therapy, and that's completely fine. It happens sometimes.
ओके, इट डिपेंड्स ऑन द थेरेपिस्ट क्वेश्चन, कि आपका क्वेश्चन अगर आप पास्ट में क्वेश्चन पूछ रहे हैं तो डेट मीन्स वो सॉल्यूशन
You just
फोकस पे
have to
चला
ask a
जाएगा।
few questions so you can have a proper list. Already, it will can go there. Also, this can go to their childhood kind of things. That yes, in childhood when I was in class UKG, I was failed, or in some volleyball match, I was failed at that moment. And because of this, from the emotion focused technique, where we focus on the primary emotion the client have because of this thought. Okay,
ठीक है मैम, ओके,
so
थैंक यू।
this is kind of the thing that a therapist should learn, that how to communicate properly with their client. First, they have to challenge the thought in the present tense, not always they have to run to the past. And with this present tense, you can go to the past thing, and then you have to bring them back to the present, so that if the client is very vulnerable, they will not get very triggered with this. Clear?
यस मैम, थैंक यू।
Any other question? Any other question, or is this clear that what is ABCDE model? Where A is the activating event, B is the belief, C is the consequence, D is the distribution, how we distribute with that belief, and E is the effect. That what is the healthier belief I can adopt. Okay. Now, just a second. Yes. So moving to the next slide, that is identify and dispute the irrational belief. Now, ask the three powerful questions: that is it logical, is it fact based, or is it helpful to my life? Okay, these are the three logical questions that you can ask your client in that particular moment. Okay, so this is where real transformation happen. Okay, when a client realize that their belief isn't helping them and they choose to replace it. Okay, so how we will do, how we know that this belief is rational? So we can use these powerful questions, simple but very effective. The first is it logical? Means does this belief follow the reason, or does it contain the extreme black and white thinking? Black and white thinking is like, if I have a glass, if it is half filled, I will see it's like completely empty or a completely filled glass. This is what the black and white thinking is. It's like either nothing or either everything. Okay. Second is the, is it fact based? Is this belief actually supported by evidence, or is it the based on the assumptions or the fear, the past wounds? Okay. So this is how we can identify, is it coming from any fact, or is it coming from any assumption, fear, or anything triggering from the past? Third is it helpful to your life? Even if it feels true, does it support your emotional growth? Okay. Or does it keep you stuck in the anxiety, guilt, or the shame, or any triggering situation right now? Okay. uh, like for example, a client believe that I must always succeed, or the client can say probably not. With the fact based, he can say that no, there's no rule that failure mean the worthlessness. Okay. Then is it helpful to your life? The client could say that definitely no, not. It create the pressure, anxiety, and the fears of mistake. Okay. Now we can help the client to reshape the belief. Like it might shift the something like, in client's mind it could be happen that I want to do well and I will try my best, but if I fail I can still accept myself and learn from it. Or I have that qualities, or I have the things in me, I can do a very good thing in my future if I failed in this test. Okay. So this new belief allow the space for the self compassion, realistic effort, and the resilience. Uh, Also, the more client practice this kind of the disputation, the more emotional flexible they become, and the better they can handle their lives up and down. Clear that how to identify and dispute the irrational belief, like how to do the D and the E part. But any doubt? Okay. Okay. So now the irrational belief, the ILS list. Here are some irrational beliefs that the client may have. So I must be loved by everyone, or I am not lovable. Okay, this is like a all or nothing. Either I should be loved by everyone, or I am not lovable. So this is one of the irrational beliefs the client have. Second could be I must do everything well, or I am incompetent. Okay. The third could be I must damn others if they do not treat me well. Okay. Fourth could be I must damn life if things do not go well. I must control the events and the people because they control how I feel. Okay. I must worry about the thing, about anything fearful or the risky. I must avoid the responsibility and the problems to be comfortable or content. I must depend on other, else my life or the self will fall apart. I must be controlled by my past and disturbed by anything that once disturbed me. I must damn others' problem and be disturbed by them. I must damn life if I cannot find the perfect answer to the human problem. So these are the main 11 beliefs according to the ILS list. Okay. So now moving to the next thing. Now we are moving into the 7 core REBT tools that we will break down one by one. So these are the main 7 techniques which we will learn today. First is the ABCDE worksheet. Second is the self-talk journal. Third is the REBT belief card. Fourth is the imaginary rehearsal. Fifth is should busting law. Sixth is inner lawyer role play. Seventh is the mirror work with the rational affirmation. So first technique, that is REBTE worksheet. This is based on the REBTE model. Okay. So this tool helps the client to break down a stressful or the emotional event using the 5 REBT steps that we have already studied. So let me walk through it, that how to use it. So what it is, It's a written format worksheet that you can give to your client, having the 5 columns ABCDE, meaning the same. Activating event: B is the belief, C is the consequences, D is the disputing the belief, and E is the effective new belief. Okay. So when to use it? So after a distressing emotional response, you can ask your client to write the things in this sheet. It's a proper tabular sheet, so they can write. Like, if the activating event says, my son return home and goes to his room without speaking to me, then there is a belief that he is ungrateful and always ignoring me. So expected outcome is the great greater awareness, emotional regulation, and the logical thinking of the client. Okay, so when the client have these kind of negative thoughts or they ruminate a lot or say harsh things to themselves, okay, this is the disputing belief. First you have to do this sheet in the therapy session so the client know that how to do this, and then after the thing that is E is build a parent child relationship on the trust, understanding, and both are happy with each other, or even if they can communicate with their child that what exactly happens or why he do this. So this could be used with the themes like anger, anxiety, self doubt, or even you can give this when the client have any emotional response, suitable for all age groups, especially for those who overreact to the daily stresses. Okay, this worksheet can be given to them. So expected outcome is the greater awareness, emotional regulation, and the logical thinking of the client. Clear till now how to use this thing? As we have studied about the ABCDE, that's why I didn't explain it in a more manner, more
Ma'am,
explanatory manner.
is it possible for you to
Yes.
go to the previous slide once?
Uh, which slide, ma'am?
The slide just prior to this, which had all the techniques written. I actually missed it.
This one?
Yes, ma'am, just a second.
This one, ma'am?
Yeah, that one. Okay, done. Thank you.
Okay. So, any doubt in ABCDE worksheet that how to use it and when to use it? Okay. So, moving forward with the second tool, that is self-talk journal. So, the second tool is self-talk journal, and this one is incredibly powerful for the client who struggle with the self-criticism. Okay, so what is it? So it's a journaling tool where client can write down their irrational or the negative thoughts and then reframe them with a more rational or the compassionate voice. Okay, when to use it? This is a perfect for the daily use, especially during the high stress time or when emotions are running high. Okay, who is this for? Works very well with the teen or the adult who ruminate a lot or say harsh things to themselves. Okay, sometimes we also said harsh thing to ourselves that for example, if I slipped a glass of water from my hand, I can say that I am a complete stupid or I'm a failure, that's why I'm doing this and this. So when the client have these kind of negative thoughts or they ruminate these kind of harsh words to them, you can give this self-talk journal to them. Okay, so what are the main benefit of this thing? That it helps the client to reduce the negative self-talk and increase the emotional awareness and build the self-kindness. Okay, for example, the client write that I am such a mess, I can't even get one thing right. Okay, so in this we can help them to reframe that I am having a hard moment, but that doesn't make me a failure. I have handled tough things before. Okay, and over time the self talk journal become a mirror showing the client just how unkind their inner voice was. Okay, and giving them the power to speak to themselves in a new healing way. Okay, you can assign this as a homework and even review the journal entries together during the session. If they are unable to replace the thought at that moment, you can just give them a journal or just give them the you can ask your client in the journal, they can write just the thoughts that they have, and in the next session together you and your client can reframe that or dispute that thought and have a healthier outcome of it. Okay, so the accepted expected outcome of this technique is reduce negative self talk and increase of the self compassion. Clear? Clear, or I was too fast? Okay, so now the next tool is REBT belief card. Okay, so what is it? So a deck of card, each with a different irrational belief written on it. The client can pick a card and then verbally dispute the belief with your help. Okay, so it's like having a proper deck of card. You can prepare them or even have a printout of these cards. In those you can write different irrational belief, and then the client has to pick one and they have to verbally distribute that belief. Okay, so this is very great for the icebreaker activities, even in the group therapy or for the workshops. When you want to introduce REBT in a very engaging way, you can use this technique to your on your clients, even in your therapy session. Okay, so who is this for? This works especially well with the groups, in the psycho education settings or even in the coaching circles. Okay, what are the outcomes or the expected outcome of this activity? So the client become more flexible in their thinking, and it turns learning into something playful rather than heavy. If I ask you to just challenge the any thought or your five thoughts, it's very difficult for you. But if you have to find out only one any random irrational belief and then you have to challenge it, this is how you can learn it in a very impactful and in a very engaging manner. For example, if I have a card that if I pick a card, on that card it is written that I must always be liked by everyone. So you can ask the group or you can ask the client, is this logical? Is it even possible to be liked by everyone? Or what's more helpful belief instead of this? Okay, so it sparked the deep insight, often mixed with the laughter, and help the people to let go these invisible rule they have been living by. And you can make your own belief card or print the sample ones, and that will make your case more interesting and engaging with the client. Even you have a pack of cards with you, and even you can keep it with you every time, and in each session when you find like the client have the negative thoughts, you can use this activity. This could be a very handy activity to you. Okay, is this activity clear? So next is REBT imaginary rehearsal. So it's like this could be a this activity could be a proper blend of the mindfulness technique with the REBT that we have understand. Now we will learn that how to do it in the therapy session. So what this activity is, in this it's a visualization activity or an exercise. In this the client mentally replays a past upsetting situation, but this time they imagine themselves responding with a new rational belief. Okay, when to use it? After the client have already identified a core irrational belief. Yes, yes, Aradhana ma'am.
Ma'am, can it be
Ma'am, your voice is breaking. I didn't.
ma'am, can it be used
Sorry,
as a
ma'am.
role play? Hello?
Yes, you can use it as a. Yes, ma'am, you can use it in the role play thing too. Okay. Even you can use a visualization technique in which you ask your client to visualize about the past event or the situation, and then answer it in a more rational manner, but in a proper guided imaginary thing, that they are sitting in a room and then they have to think of a past, or they are moving in a garden, or they are sitting over there, then the situation happens and then they are working rationally, and then again back to the room, and they are you can use even the grounding techniques in this. Okay, Yes. So when to use this technique? After the client already have identified a core irrational belief, especially useful for the events that still carry the emotional charge, you can use this technique. Who is this for? Works best with the adults or the clients dealing with trauma, guilt, anxiety. You can use this technique on them. Expected outcome could be the client begin to emotionally integrate a new belief, and not just intellectually but in a felt embodied manner. Sometimes some clients can say that yes, you are logical, I can understand it, but I cannot feel it. Okay, I cannot feel it from my heart. So at that moment you can use this visualization thing in which they will visualize it. Okay, and this is how they can some clients that they are still after having a logical question are not accepting this thing can accept the things. For example, a client visualize a memory where they were publicly criticized. They originally believe that this proves that I am worthless. So in the imaginary rehearsal we guide them to imagine responding with a belief like criticism hurt, but it doesn't define me, I can still respect myself. Okay, so this exercise helps them to release the shame and rebuild the inner safety. Okay, I often tell my clients to let go back and now not to relieve it but to rewrite it. Okay, clear? So next technique is should busting daily log. So here's a simple but very effective tool, the should busting log. So what is it? It's a daily log where the client write down whenever they use should, must, or have to, and then practice replacing it with the more flexible language. Okay, when to use it? In between the sessions, you can use it as homework. You can also use it especially for the client who are struggling with the perfectionism, burnout, or any pressure. You can use this technique on them. So who is this for? Anyone who uses the harsh internal language or set the unrealistic expectation with themselves, you can use this technique on them. Okay, the expected outcome of this activity is the self kindness and the flexible thinking, and even the client build the self compassion and start living from the choice instead of the rigid demand. Okay, for example, client write like I should have been more productive today. Okay, so we help them to shift that thinking or that thought to I wanted to do more and it's okay that I needed a rest today. Okay, this is how we shifted that thing, and this one change can help them to move from the guilt to the grace. And then you can ask the client to do this daily for weeks, and you will notice that how much lighter their self talk begin. Okay, even when they have a very harsh talk about themselves, this is the easiest way to replace it. Sometimes the positive affirmations or these things also can help, but the core beliefs that we have, we already said it, even in the worst situation or even in any triggering situation, this is how you can replace the thoughts that the client have. Okay, is it clear? Any doubt, any question? Am I going too fast? Okay. So moving forward with inner lawyer role play. So this is also one of the biggest technique that in majority of the cases I also personally use this technique. Even when the client have the stronger belief about themselves, and even to create the resilience, even if when they are holding on to it and they don't want to leave it. Okay, so I use this technique, that is inner lawyer role play. So what is this? In this, the client pretend to be the inner lawyer defending a rational belief in a mock courtroom against their inner critic. It's like they have to set up like a court. Okay, in that they are sitting on the judge chair, and there in front of them there are two lawyers. One is the prosecution and second is the defense lawyer, and then they have to work with that particular thought. Okay, uh, it's like in a inner code settings. Okay, when to use it: once the client have developed a new rational belief but doesn't fully believe it yet. Okay, when they know that yes, there are the sides and there, like there is something that is against of this thought in favor of this thought, then they can have this technique. This is very great technique for the teens, for the adults, and the self critical individuals. Okay, the expected outcome of this technique is for the client to gain the confidence in their new belief and learn to fight back against the old limiting one. Okay, limiting the one they have. Okay, for example, they might have an old belief that I am a failure because I didn't get the job. Okay, the new belief after doing this technique they can have is, this was one experience, it doesn't define me. Now the client have to defend the new belief, that here's my evidence, this is why it is logical, this is why it helps, and the prosecution will try to give the evidence why this belief is not true. Okay, so it's very empowering, and it turned the self talk into active and the life skill. Is it clear? Any doubts?
Little example.
Okay. So moving to the next technique, that is mirror work with the rational affirmations. Okay.
Hello,
So yes, ma'am.
ma'am. Can you give example of role play technique, lawyer technique?
Okay, lawyer one, na? Okay. So in this, mm, let's have a situation. Okay, not a particular thought, let's have a situation so you can easily understand. Like for example, if I'm in a relationship in which my partner ghosts me every time, and now I am in a dilemma whether I should stay in that relationship or not. Okay, this is a very simple thing. At this moment, what I can do is I can use this technique, that is inner loyal role play. In this, I will create one defender, one person who is in the favor of this thought that I should leave him, and a second person, the defense person, who is in the against of me, that I should uh, not leave this relationship. Okay, now as a lawyer I will give the evidences that why I should leave this person, and from the defense perspective I will give the reasons or the evidences, or even the things that I have in myself, that why I should not leave this person. And after doing like a proper battle of these things, then I can have a proper judgment kind of thing, that what exactly should I do in this situation. Okay, now is it clear that how I am doing this? Like for example, I can say
Yes,
that
ma'am. It's clear now.
the so this is like from the situation, this is what the client can do with a particular thought that they have. Okay, any more doubts? Any doubts or anything else? Okay, just a second. Now moving to the next activity, that is mirror work with rational script. Okay, so uh, what this technique is, in this the client stand in front of the mirror and say the new rational belief out loud. Okay, looking themselves in the eye, because as we know that when we look at the mirror we have a proper reflection about ourselves. Most of the time we didn't say wrong about ourselves, or we didn't say negative, or we didn't say false in front of a mirror. Okay, so that's why we are using mirror in this activity. In this the client has to say the new rational belief out loud by looking themselves. And when to use it: after the irrational belief have been disputed, to internalize the new belief emotionally and physically, you can use this technique. Like for example, if I have a belief about anything, and in the last session we have disputed that belief, and now to accept it, to internalize it, from the next year onwards I will stand in front of the mirror and I will say this thought repeat and repeat so that this can be internalized in me. So this technique is very perfect for the adults working with children who even have the body image issues or healing from the inner critique. You can use this technique with them. For example, looking into a mirror and saying that I don't have to be perfect or to be worthy. I accept myself as I am. This may feel awkward at the first, but over the time, this practice helped them to build a relationship with the self, not just in the mind, but in the heart and the body too. Okay. I often say to my client that it's not just what you think, it's what you say to yourself out loud that create the change. Even if I have to give them the positive affirmation to recite them daily or even to boost their confidence, I use this technique in which I set them to talk to themselves in a positive manner in the front of the mirror. And this literally help even with the adults, and even in one or two in my even in the cases of the teenagers, this technique could be very helpful for them. Okay, the expected outcome of this activity is to internalize the self acceptance and the emotional regulation. Okay, so clear till now or any doubt? Okay. So moving to the case. So this is the case. In this, the client name is Sanjana. She is 24 years old. She avoids giving presentation or sharing the opinions at work. Okay. After one past incident where a senior laughed at her idea, she developed a strong fear of being judged. She now believes that if someone criticizes me, it means I am worthless. So the major issue with this client is the core beliefs are I must always be approved by other. Emotional consequences are the anxiety, avoidance, low self-esteem. The behavioral patterns are the social withdrawal, overthinking, and the excessive apology. Okay, is this case clear? Okay, so now uh, as we have discussed so much about the REBT, so which REBT technique could help this client and why? We have learned 7 techniques. So from that, which technique you can give this client and why do you think that technique can help her? Just take your time, think, and you can even write or just let me know.
Ma'am, that ABCDE worksheet can help to identify the issues
Okay, great.
and then we can move forward to um, that imagery or lawyer technique,
Okay, that will also help.
or we can do like
Mom, I didn't get your last words.
we can do role play
Good, good. We
role
can do
play
the role play.
conversation so that सोशल विड्रॉवल थिंग वो थोड़ा सा कम हो जाए और रियल लाइफ में भी जो क्लाइंट है वो थोड़ा सा कोशिश
Yes, and also you can in this you can use the imaginary rehearsal. If they are not able to do in the role play, they can first think, and then you can give them a way to challenge them. Yes, self talk
करेक्ट
journal can help her, and even the mirror technique that we have learned can help her, can help this
mirrored
client.
can also work.
Yes, this can also help her. Okay, the ABCD worksheet can also help. Even if the we can first identify or we can ask the client, is there any other, or we can observe that is there any more irrational belief that she have. For that, we can use the REBT that deck card thing. Okay, that how to challenge those different techniques so she can have a proper coping skills, so in future if she have more irrational beliefs she is able to challenge them by herself. Okay,
जैसे कोई
anyone else?
जो है वो थोड़ा ऐसे खुद से काम उतना नहीं करना चाहता है या फिर नहीं कर रहा है और मतलब कि उसके बहुत सारे बिलीव्स है, तो मुझे लगता है वेरी वेल, क्योंकि हम
Yes.
एक भी उनकी इमोशन पे उतर उस प्रॉब्लम हम तो थोड़ा क्लाइंट को भी ऐसे काम कर रहा है तो अब मैं से भी करता हूँ.
Yes, and also you can prepare them for the future. Maybe there could be any more triggering events in the future that can cause the relapse in the case. Okay, so in this, you will empower your client for the lifelong learning that how they can challenge the particular belief and they can lead a more impactful and a good life.
And there will be no
Okay.
see.
Okay. So this will help you in the relapse prevention too. The things that we are using, because in one of my case the client was completely healed, okay, from all the negative beliefs and everything like that. But now she was not prepared because she doesn't come from the session from last for when we have to do the relapse prevention thing. She was not present, she stopped the therapy at that moment. So because we didn't do these kind of activities with her, and that's why she is facing relapse right now. She called me and told me that she again need the session because we are unable to work on the relapse thing. Okay,
Ma'am,
so this is
can you
how you
also do exposure therapy?
in this.
Yeah, in this, I'll tell the client that present your presentation first to me, and then फिर आप वही
Hmm,
प्रेजेंटेशन जो है आपके क्लोज वंस, जो आपके क्लोज कलीग्स है, जो आपको लगता है कि वो आपको जज नहीं करेंगे, जिनके साथ आपकी बॉन्डिंग अच्छी है, आप
hmm,
उनको प्रेजेंट करो. एंड देन फिर
hmm,
मतलब आफ्टर एक्सपोजर थेरेपी के साथ साथ हम दूसरे थेरेपी के साथ जब उनका कॉन्फिडेंस थोड़ा सा बिल्ड कर दे कि लाइक नाउ शी इज रेडी और ही इज रेडी टू प्रेजेंट बाय मतलब इन फ्रंट ऑफ एवरीवन, तब हम
hmm,
उनको ये बोलेंगे कि अगर आपको वाइल डूइंग प्रेजेंटेशन आपको ऐसा लगे कि नो
hmm,
मुझे घबराहट हो रही है या फिर अनइजीनेस फील हो रहा है, तो आपका
hmm,
जो आई कांटेक्ट है वो आपके क्लोज वन के साथ मेंटेन करके रखो, सो दैट
hmm.
ऐसा हो जाएगा कि हाँ आपको अगर अनइजीनेस फील हो भी रहा है बट स्टिल यू नो हैंडल द सिचुएशन कामली, और ओके ओके वाला सिचुएशन हो गया हैंडल, वैसा ऐसा बोल सकते हैं.
You can do this, but in the case where the confidence is brutally broken up, okay. In this case, what happened is someone laughed at her, okay, someone criticized her, and because of that, she is feeling that I am worthless. In reality, it doesn't happen, okay. She doesn't have any issue in giving the presentation or something like that. So in this case, you don't have to give a proper exposure therapy. You have to first challenge the thought. But yes, if because of this trigger she her confidence is completely shaken up, you can tell her or you can use this technique on her. Okay, you can use the exposure therapy
Ma'am, I
at that
think
moment when.
this can work like later.
Yes, this is what I'm saying. This is helpful,
So
but not at this present moment when there is just one trigger. Like if the client have the irrational belief, along with that, from the past like 2 years, she didn't give any presentation because of this. There is a very long time period, and when now if she is trying, she is feeling very, her self esteem is very low. Okay, or she is not feeling very confident. At this point, you can start exposure therapy along with the REBT technique, so you can challenge the thought and even build the confidence in the client. So the behavioral pattern she have, that is social withdrawal or overthinking, this can be removed.
can I ask you for a guidance, as I am still a fresher for one
Okay.
case? Can I?
Like how can I help?
Like
Yes. Sure.
one of my student came to
Hmm.
me, and उसका problem
Hmm.
ये था कि in fifth standard there is one teacher who pinpointing her and insulting her for not participating in the classroom, for not answering the questions correctly. तो उसके साथ बहुत ही
Hmm.
ज्यादा रूड बिहेव किया, स्पेसिफिकली पूरे सब ग्रुप के सामने उसको पिन पॉइंट किया कि दैट किसी के ऐसा ऐसे कि तुम लोग ऐसे बच्चे नहीं हो जो आंसर नहीं करते हैं, तो ऐसे बच्चों की तरह नहीं होना है, इनडायरेक्टली पिन पॉइंटिंग करना और बहुत ज्यादा उसके साथ रूड बिहेव करना,
हम्म
अगर क्लासरूम में लेट आ रही है तो इंसल्ट करना, स्लैप करना, ये सारी
हम्म
चीजें उस टीचर ने उस स्टूडेंट के साथ की है। नाउ अभी वो 6 स्टैंडर्ड में है
हम्म
और शी सेड कि उसको अभी हर टीचर से डर लगता है कि अगर मैंने इंटरेक्शन किया तो मे बी, या फिर मैंने
हम्म
इंटरेक्शन नहीं किया या मैंने गलत आंसर दिया तो नाउ एवरी टीचर विल जज मी और बिहेव लाइक दैट टीचर ओनली, कि हाँ जैसे वो टीचर ने मेरे साथ रूड बिहेव किया था बाकी टीचर भी मेरे साथ रूड बिहेव करेगी। तो इन दैट
हम्म
सिचुएशन मैं उस मैं मतलब उसको कैसे थेरेपी अगर आगे कैसे बढ़ाऊँ मैं।
ओके, सो फर्स्ट जस्ट टेल मी, जो भी टीचर थी जिसने ये सारी चीजें करी, क्या वो अभी स्टिल मतलब क्लाइंट के एक्सेस में है? क्या वो उससे मिल रही है या उसकी मतलब कोई भी सब्जेक्ट उसे पढ़ा रही है?
फॉर नाउ मतलब अभी 6 स्टैंडर्ड में तो नहीं, बट या ऐसा क्लास स्कूल में मे बी ऐसा फेस टू फेस इंटरेक्शन होता रहता है फॉर सम टाइम, लाइक प्रॉक्सी लेक्चर में कभी आ जाती है वो, या फिर ग्रीटिंग इवेंट, अगर वो ग्रीट कर रही है कहीं कॉरिडोर में, वो दिख गए टीचर तो ग्रीट करिए तो ग्रीट बैक भी नहीं करते हैं, दिस ऑल द थिंग्स स्टूडेंट्स सेड मी।
ओके, सो ओके, आई अंडरस्टैंड इट। अगर वो टीचर नहीं है तो इट्स ओके, मतलब ज्यादा एक्सपोजर नहीं है क्लाइंट का उसके साथ, तो एट दिस पॉइंट यू कैन यूज द एक्सपोजर थेरेपी विद द क्लाइंट, बट फर्स्ट वर्क ऑन द सेल्फ एस्टीम पार्ट. Even the mind, you can give the PMRT thing first, calm down the client, because at this moment her self esteem is really low. If you suddenly go and try to challenge the thoughts with her, she will not understand it, okay, because there are the deep scars in her hurt because of that teacher. Okay, so first work on the mind, the self esteem part, and the mindfulness based technique. In this you can use, even use the art therapy techniques to express what she is feeling, even to remove the guilt and the shame that she have. And after this, after 1 or 2 sessions, she will have a confidence in herself. Then you can start with the exposure therapy, okay, in which you can ask your client, or you can prepare her to ask the question from the, even from the 1 or 2 teachers who are very good with her. And after that you can start working on the irrational beliefs. This is what you can do with
Uh,
this client. I think this will help her.
thank can you repeat that abbreviation that you
Okay,
mentioned between self-esteem and the other thing?
the mindfulness technique, in which
No,
you
no,
can give
after that.
PMRT to the client.
Yeah, PMRT.
After okay, PMRT is a proper relaxation technique in which we work on the stored emotion or the stored tension that we have in our muscles. This will help to create the mind body balance in the client.
Thank you so much,
Okay.
ma'am.
Yes. First, work on the emotion part so that she can release that thing, then build her confidence, then give her the exposure. If you directly work with the thoughts, this will not help her because there are very deep scars in her, and that could cause the childhood, that is like a trauma she have. You have to release it first. Okay, so is this case clear? Moving back to the PPT, is this case clear?
Yes, ma'am.
Okay, okay, so now any question, anything from the starting to end, any question that you have related to REBT or
Ma'am,
anything
I
that
have
you
a
want to say?
question.
Yes, ma'am.
Not specific related to RBT, but like I want to know like how to practice questioning skills, how to improve it.
uh,
Because
how to improve?
whatever therapy you use, you start with questioning only rather than writing.
Ma'am, sorry to interrupt, but your voice is not clear. It is breaking a lot. Can you type it down or just say it once again?
Hello.
Yes, ma'am. Now you are audible.
Audible now. क्वेश्चनिंग स्किल्स को कैसे इम्प्रूव किया जाए या फिर कैसे प्रैक्टिस किया जाए दैट वी कैन इम्प्रूव क्वेश्चनिंग, बिकॉज हर थेरेपी जो है वो वहीं से स्टार्ट होती है, क्वेश्चनिंग से ही। अगर आपका राइट क्वेश्चन है देन यू कैन लीड द थेरेपी अहेड वेरी वेरी एंड इजीली।
ओके, सो इसके लिए फर्स्ट ऑफ ऑल आपकी ऑब्जर्वेशन स्किल्स काम आएगी। ठीक है, इसके लिए फर्स्ट ऑफ ऑल गो विद द थेरेपीज और गो विद द इंटर्नशिप्स बेसिकली दैट प्रोवाइड यू द प्रैक्टिकल एक्सपोजर इन विच they give you a proper experience to listen to the client, okay, or even some role plays cases that they give you, so you can understand what the client is saying and what are the hidden meanings and how to find the hidden meanings. And if you are not if you are unable to do any internship, you can go on the YouTube and look for the different case studies or different role play cases that is already present on the YouTube. That will also help you to improve your observation and the listening skills. Okay, and the second thing, with time, when you are able to do or take sessions of 1 to 2 clients, this will help you out to understand them well and to basically understand what are the things that you can say. Along with that, use some expressive art therapies or use some techniques that could be handy with you at this moment or in the therapy session that can give you the insights about the client. Okay, sometimes it is not possible to, even with me also, it is not possible to ask the question or ask the correct question. Sometimes I also fumbled at that moment. So at that point, I use the different activities based on the theme or based on the things that the client is saying. And because of that activity, that give me a proper thing that now what are the questions that I can ask to the client. Like for example, I can give them a activity like safe space. In this, I can ask the client to think of a place that feels safe to them. Okay, and after that, when they give me the activity, then I can ask them, okay, so what is safe space to you? Who are the people that you have included in that safe space? Is this place real or imaginary? Okay, and now how do you feel at this moment? Have you feel this like this anywhere in the real life when you feel it? Okay, this is how I have created my flow. So every therapist work on the different concepts and the different things. For me, it's like having the different activities and observing them, first observing them to find the patterns, and then build a question along with that. This is what works for me.
Thank you so much, ma'am. Thank you.
This come with the observation and the listening skills, and for that you have to take a proper internships or you have to observe the
Mm-hmm.
cases on the daily basis. You can use the role play techniques that are
Okay.
present, they are plenty present on the YouTubes, and that will literally help you out.
Okay, ma'am. Thank
Make
you.
your own case things, post case notes by them. Then that will also help you to make the how to make the case notes and what are the questions that you can ask
Mm-hmm.
your like, like so
Ma'am,
Okay, ma'am.
yes.
Thank you.
ma'am, I have a question for you. Like those who have paid
Yes.
for that notes also, where they are going to receive that notes.
In next 3 days, you will get the certificate and the resources in the group in the form of a drive link.
Okay, thank you so
Okay.
much, ma'am.
Yes. So, any other questions? Or you can just give me a quick feedbacks that how do you like the session? It is comprehending, not comprehending. Whether you are able to resonate with that or not.
Ma'am,
So
it
that
was
in further.
amazing.
Thank you, ma'am.
It was really
First,
like that how you handle questions and try to answer every question very specifically and very detailed.
I hope this literally help you out, and this will help you out for the rest of your life in your therapy practice. So I have one more question that with her adolescent who is using tobacco and want to leave it. Okay, his trigger when he's being scolded at the school. Okay, so whether he is ready to leave that tobacco thing, Kriti ma'am.
Yes, ma'am, he is.
He is ready. Okay, so Okay, he is taking it 3 to 4 times in a week. You can use the exposure therapy in this, try to reduce the intakes of the tobacco. Along with that, you can use the PMRT thing, PMRT or any mindfulness thing. So he can have a balance in his body and replace this activity with something else. Like while he have tobacco, he have a dopamine release in his mind. So you can have a motivational interviewing in this case, or replace the time when time when he eats the tobacco with some productive activities that he can do. Like if he have a urge to eat that thing, he or she can use a earth surfing meditation. Okay, along with that, um, uh, some collage making you can give to them if he or she is, if he required. Along with that, okay, some mindful of some activities related to the mouse. Okay, you can give that. Just because I'm not an expert with the tobacco or the substance abuse thing, I cannot tell you the particular techniques. But yes, this is some techniques that can help him if he is ready to divert his mind.
Okay, ma'am. Thank you so much.
I literally hope this workshop is very helpful to you, because so today we have basically learned about the root of irrational belief, how to apply ABCDE model, the 7 practical techniques in the REBT that you can use on your client, applied theory through a real client case, and explored how REBT integrates with the other modality. I'm really happy that you loved this workshop. Your positive feedbacks are really important for me. It's literally motivates me for my upcoming sessions. So yes, next week also, next Wednesday, we are coming with one more workshop or one more masterclass on the positive psychology. In that, we will learn what is positive psychology and how to use it in the practical way. I hope to see you guys in that class too. That masterclass is also free of cost to attend. But if you want the certificate and the resources, that is just for rupees 95 only. You can contact me on this number. Can I do it now or how? Yes, you can contact me on this number, or else I will send the registration link, the Google form link after this session in the group. You can fill that also. You will get the certificates in next 3 days. Okay. And for the positive psychology, if you want to attend it also, that is free of cost. If you need the certificate and the resources, you can contact me on this number. Along with that, we are also coming with one more workshop on this Sunday, that is on cerebral palsy, that will be taken by a RCI licensed special educator. So if you are interested in that also, you can also attend it. That workshop is also free of cost to attend. But if anyone, okay, ma'am, do you have any WhatsApp group? Yes, the learning circle group from where you have get this link. Otherwise, if you are not connected in any group, just contact me on this number. For the Sundays workshop is also free of cost, but if you need the certificate and the resources, that is also for rupees 59 only. As you have, we spend a lot more amount in the coffee dates and everything like that. So it's like for your betterment. If you want to join, you can join. These are the services that personally I provide in as a therapist. Okay, if you have any case referral or anything like that, you can contact me also for that. And otherwise, thank you everyone for being with me for such a long time, for hearing me and giving me so much positive response. That will help me to grow further in this field and give you more content like this. I hope you get a proper knowledge on this and all your doubts have been cleared. Okay, thank you everyone. So Sakshi ma'am, it is taken by a RCI licensed special educator. It's on the cerebral palsy, that what the cerebral palsy is, and how, if you are a special educator or if you are a person who deals with them, that how to deal with them in a proper manner. It's like a 1 hour workshop. It's also free of cost. If you want to attend, you can also attend it. Okay, otherwise, thank you everyone for being with me. Now you can start leaving it.
Ma'am, for the next session, can you add the, at last, sorry, role play